So there are two main types of circuits that we need to think about with respect to ADHD, attention and dopamine. The first one is called the default mode network. The default mode network is the network of brain areas in your brain, in my brain, and in everybody's brain that is active when we're not doing anything, when we're just sitting there idle at rest. Now, it's very hard to not think about anything, but when you're not engaged in any type of specific task, so you're not driving, you're not playing a video game, you're not trying to study, you're not trying to listen, you're just sitting there letting your brain kind of go wherever it wants to go, your default mode network underlies that state of mind. The other set of circuits that we're going to think about and talk about with respect to ADHD are the task networks. The networks of the brain that make you goal-oriented or that are at least trying to make you goal-oriented. And those are a completely different set of brain areas. However, the default mode network and these task networks are communicating with one another, and they're doing that in very interesting ways. So first, I want to describe how these two sets of brain areas, the default mode network and the task networks, normally interact. Okay? So a little bit of naming here. Again, feel free to ignore it if you don't want this level of detail. But the default mode network includes an area called the dorsolateral prefrontal cortex. Frontal cortex, no surprise, is in the front, and you have a dorsal, the top, and side, lateral part, dorsolateral prefrontal cortex. You got one on each side of your brain, right? And then you have a brain area called the posterior cingulate cortex. And then you have an area called the lateral parietal lobe. Again, you don't need to remember these names, but these are three brain areas that normally are synchronized in their activity. So when one of these areas is active in a typical person, the other areas would be active as well. So it's a little bit like a symphony or a band, like a three-piece band. It's like drums, guitar, and bass. They're playing together, okay? That's how it is in a typical person. In a person with ADHD, or even a person who has subclinical ADHD, or in any human being who hasn't slept well, what you find is the default mode network is not synchronized.